This video represents success stories of some patients treated with Aricept, donepezil hydrochloride, as described by themselves and observed by caregivers and physicians. All comments were unscripted responses to questions about Alzheimer's disease and treatment with Aricept. Aricept is indicated for the treatment of mild to moderate Alzheimer's disease. Individual responses to Aricept treatment may vary. Improvement, stabilization, and decline have been observed in patients treated with Aricept in clinical trials.
I was an accountant my entire life, and I was a whiz with numbers, but suddenly I couldn't do the math.
He became forgetful. Kept on saying, remind me to do this and remind me to do that, and, you know, I didn't always remind him, and he would get angry.
I noticed, and my 3 adult children noticed, that Ann's short-term memory was starting to fade.
I was pretty downhearted because I used to devour books. I once had a wonderful memory. I was a top-notch student. And here I was, just the opposite of what I had been.
Hi, Mr. Graham. How are you?
Good.
How is he doing? When Al came to see me, he was brought by his wife. There was enough there between the memory and the behavior to make me suspect Alzheimer's disease. And I suggested right off the bat at my first visit that the patient start Aricept. Research has shown that you really should move a patient on Aricept as soon as you know what the diagnosis is. And the reason for that is that you're trying to preserve as much acetylcholine in the brain as possible.
Originally, Dr. Wolf Klein put me on 5 milligrams of Aricept a day, and she increased it to 10 milligrams. So that's what I'm on now, 10 milligrams. And I just see a big difference in it at this time.
He was angry at the world. He was held it within himself. He didn't do much talking.
I became very active. The Aricept seemed to help me a lot. I'm very upbeat. Getting acquainted with the people in my group, it's very stimulating.
Having worked with clients for the last 13 years, I can see the dramatic change with the use of Aricept. My clients still go to the opera. They still travel. One of my clients just recently went to China for 3 weeks. My clients volunteer. They get up and sing at the holiday parties. They're living life and enjoying life, and I take a lot of lessons from them.
What we'd like to talk about this morning is, did you notice any change after you began to take the Aricept?
I think it must be what has stabilized me so that I am relatively clear and thinking.
You may not notice a difference, okay? I really couldn't say whether it is or isn't working, except for the fact I don't feel I'm progressing downhill that fast anyhow.
I continued with my creative work because that's as natural to me as breathing. And it's nice to come down to this group with all my buddies here, and we share experiences and we enjoy life.
Our program here at the University of Rochester has been involved in several of the studies of Aricept. This is a medication where we're saying there may be about a 1 in 5 or 1 in 6 chance of getting a short-term robust benefit, and probably a 50% chance of preservation of function over a period of time in a disease that is otherwise relentlessly progressive.
I've been taking Aricept for about 4 years. I'm still running a household. I still cook. I think I'm still functioning at a fairly high level.
I have seen maybe the last year or so
The short-term memory is getting a little worse. However, it's not constant. The beauty is she still has tremendous cognition. She's able to function every day, and that's a wonderful thing.
We have 3 children who we adore, and he couldn't remember their middle names, and he got very depressed from that.
Well, the first name is Debbie, and the way I knew that, when she was a little girl, I used to sing her, Debbie Sue, I love you. And so I remember that name, and then I remembered Stephen's name's Stephen, I forget, Irish Shapiro, and my other son's name is Matthew Scott Shapiro. And so I practiced that every other day so I could remember it. I saw a big change with the use of Aricept.
We have to become, as physicians, very realistic about our expectations. The process itself is a downhill course. We have to understand that. If you can change this curve and flatten it to a stabilization curve, you've actually achieved success. This is a therapeutic success.
It would be a mistake to give up after a period of a few months and say, oh, well, they didn't get, quote, better. Because you're depriving that person of the long-term benefits that can occur, and you're also exposing them to the very considerable risk of sudden decline, which is likely to occur with cessation of this therapy.
In some cases, a physician might have a family come back and say, there's been no change. Well, that's it. That's what Aricept is supposed to do. That is lessening the decline.
He starts on the Aricept. He's talking to our sons. He's happier. He now feels comfortable in a group of people, which even about a year and a half ago when he started, certainly he didn't at all.
When the doctor said, but we'll give you a drug, it was a very positive thing. As you said, you felt like, well, you were able to do something anyway, you know, rather than just sit back and have this disease take over.
I can tell people that I have something to offer that may help, and here's how it may help. And I can look them in the eye and tell them, here are the odds, and here's what we're going to look for, and I'm going to stand by you while we implement this and monitor the treatment over the long haul. I couldn't do that before.
I've never no problem with it, ever, except I forgot where I put it.
I look at my grandchildren and my children, and I feel that there's a life ahead. It's wonderful.
You wouldn't wait in initiating treatment for high blood pressure or cancer. Why would you wait in initiating therapy for this disease?
We travel, we go to
Archaeology
meetings, we go to theater. I haven't retired from the human race, and I don't intend to for a long time.
This video represents the experiences of some patients treated with Aricept, donepezil hydrochloride, as described by themselves and observed by their caregivers and physicians. All comments were unscripted responses to questions about Alzheimer's disease and treatment with Aricept. Patients and caregivers were not compensated for their participation in this video. Aricept is indicated for the treatment of mild to moderate Alzheimer's disease. Individual responses to Aricept treatment may vary. Improvement, stabilization, and decline have all been observed in patients treated with Aricept in clinical trials. Common adverse events in controlled clinical trials with Aricept were nausea, diarrhea, insomnia, vomiting, muscle cramps, fatigue, and anorexia. Controlled clinical studies of Aricept have shown no increase relative to placebo in the incidence of either peptic ulcer disease or gastrointestinal bleeding. Nevertheless, cholinesterase inhibitors may be expected to increase gastric acid secretion. Therefore, patients, especially those at increased risk for developing ulcers, e.g. having a history of ulcer disease, receiving concurrent nonsteroidal anti-inflammatory drugs should be monitored closely for gastrointestinal bleeding. In controlled clinical trials, syncopal episodes have been reported in association with the use of Aricept, 2% versus 1% for placebo. Please see important product information provided by your Aricept representative.